If you're dealing with mild to moderate pain like headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains, non-aspirin pain relief can help. It can also be used to reduce fever. It's important to follow the recommended dosage and take it as needed when you're experiencing pain or fever. Remember to always read the label and consult with a healthcare professional if you have any concerns. When taking non-aspirin pain relief, always follow the directions on the product package. Different brands and forms of acetaminophen may have different dosing instructions, so be sure to read them carefully. Do not take more acetaminophen than recommended. If you are giving acetaminophen to a child, make sure to use a product specifically meant for children and use their weight to determine the correct dose. If you don't know your child's weight, you can use their age. For liquid forms, be sure to shake the medication well before each dose and use the provided dose measuring tool to ensure the correct dose. For tablets, follow the instructions on whether to chew, dissolve, or swallow them whole. It's important to take pain medications at the first sign of pain for them to work best. If you wait until the symptoms have worsened, the medication may not work as well. Do not take this medication for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat along with other symptoms, consult a doctor promptly. If your condition lasts or gets worse, or if you develop new symptoms, be sure to consult your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects from this medication, be sure to contact your doctor or pharmacist right away. Your doctor has determined that the benefits of taking this medication outweigh the risk of potential side effects. While serious allergic reactions to this drug are rare, it's important to seek medical help if you experience symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. And always consult your doctor for medical advice about any side effects you may experience. It's important to follow your doctor's instructions and take the recommended dosage at the best time for maximum pain relief. Taking too much acetaminophen can be very dangerous, especially for your liver. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less. It's important to ask your doctor or pharmacist how much acetaminophen is safe for you to take. Make sure to check with your doctor or pharmacist before using any other medication that contains acetaminophen. Acetaminophen can be found in many non-prescription and prescription medications, such as pain relievers, fever reducers, or cough and cold products. Be sure to check the labels on all your medicines and ask your pharmacist if you're not sure. If you take too much acetaminophen, seek medical help right away, even if you feel fine. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Using alcohol daily, especially when combined with acetaminophen, can harm your liver. It's best to avoid alcohol altogether when taking this medication. Remember to always follow the instructions from your healthcare provider and pharmacist, and never exceed the recommended dosage. Before taking non-aspirin pain relief, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history, especially if you have liver disease or if you regularly use or abuse alcohol. If you're considering liquid products, chewable tablets, or dissolving/effervescent tablets and powders, be aware that they may contain sugar or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to speak with your doctor or pharmacist about using these products safely. It's also crucial to inform your doctor if you are pregnant before using this medication, as well as consult with them before breastfeeding, as acetaminophen can pass into breast milk. It's important to be aware that non-aspirin pain relief medications may interact with other drugs you're taking, which could change how they work or increase your risk for serious side effects. It's a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Also, let them know if you start, stop, or change the dosage of any medicines. Some products that may interact with non-aspirin pain relief include ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, which could potentially cause false test results. It's important to make sure that the lab personnel and all your doctors are aware that you are taking this drug. Always consult with your doctor or pharmacist before making any changes to your medication. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or having difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can reach their local poison control center by dialing 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. It's important to take the correct dosage of this medication and to seek medical help if you suspect an overdose. Unlike NSAIDs such as aspirin, ibuprofen, and naproxen, acetaminophen does not lead to stomach and intestinal ulcers. However, it also does not have the same anti-inflammatory effects as NSAIDs. It's best to consult your doctor to determine if acetaminophen is the right medication for you. Acetaminophen is used to relieve mild to moderate pain from headaches, muscle aches, menstrual periods, colds, toothaches, and backaches, and to reduce fever. The usual daily dosage for adults is 325 mg to 650 mg every 4 to 6 hours as needed. It's important to not exceed the recommended dosage to avoid liver damage. It's best to take acetaminophen with food or milk to prevent stomach upset. Remember to follow the instructions on the label and consult your doctor before taking acetaminophen if you have any concerns. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. If it's close to the time for the next dose, then just skip the missed one. Take the next dose at the regular scheduled time. Do not take 2 doses at once to make up for the missed one. When it comes to storing non-aspirin pain relief medications, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposing of non-aspirin pain relief medications, never flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.